Help me study for my registered dietetic technician exam. Here are 8 follow-along practice questions of a mixed set. Why should honey never be given to infants? A. Spores on honey can produce botulism. B. Too sweet can achieve hyperglycemia. C. Honey is regularly genetically modified. D. Honey is a highly allergenic food to infants. The correct answer is A. Spores in honey can produce botulism. The American Academy of Pediatrics states that honey should never be added to foods, water, or formula that is fed to an infant under 12 months of age. This includes honey in baked and processed foods. Honey may contain dormant botulism spores, which can lead to botulism poisoning to infants. The soil may contain botulism spores and bacteria, and the flowers that bees feed upon can grow in this soil. Honey can also be contaminated with pollutants from bees. In healthy adults, there is little threat of harm because the amount of botulism spores is very negligible. Healthy adults have matured intestinal tracts that have enough acids to destroy the toxins produced by the botulism. Honey can accumulate enough toxins to kill an infant under 1 year of age. Once an infant is over the age of 12 months, their intestines should have matured to the point of producing adequate acids to counteract the botulism toxins. Did you get it right? Let's do another. Mr. Honeypot is an edentulous 83-year-old man who lives with his wife in Southern California. He is mildly active, walking around the neighborhood on most days and tending to his garden regularly. His wife cooks meals for them both and does the grocery shopping, yet has to be careful being on a limited income. Based on this information, what nutrient deficiency would you expect Mr. Honeypot is most likely to have? A. Iodine. B. Calcium. C. Vitamin D. D. Vitamin B12. The correct answer is D. Vitamin B12. Based on the information in this question, Mr. Honeypot has a higher susceptibility of being deficient in vitamin B12. But why? 3 reasons. First, the absorption of vitamin B12 decreases with age. The information in the question tells us that Mr. Honeypot is 83 years old. Second, he is also edentulous, meaning he is without teeth. Aside from supplements and injections, vitamin B12 is found in large amounts in animal foods, specifically high in shellfish, organ meat, and meats, all of which require the ability to chew. Lastly, the couple is on a limited income. Purchasing these animal foods may be too costly for the couple to buy on a regular basis, not to mention the extra effort Mrs. Honeypot would have to put forth with pureeing the meats. Another point on this piece is the fact that the couple has a vegetable garden. With this information, we can assume the couple may be canning the vegetables they grow. The vegetables would also be easier to puree for Mr. Honeypot. Let's look at the other answer choices and see why the vitamin B12 deficiency is the most likely. Vitamin B6. This nutrient is found fortified in many grain products and is also present in many vegetables, so this shouldn't be a concern to the honeypots based off the information provided in the question. Vitamin D. While a deficiency in vitamin D is common in the elderly, Mr. Honeypot lives in a very sunny part of the nation and he spends time outdoors taking walks and working in the garden. Vitamin C. It's pretty difficult to get a vitamin C deficiency as there are many foods providing the nutrient. Plus, the honeypots have an active garden, which we can assume there are some vitamin C-rich crops growing, such as peppers, tomatoes, and strawberries. Calcium. There are no identifiers in this question that would lead us to believe Mr. Honeypot has a calcium deficiency. Iodine. With the addition of iodine to salt and being fortified in many grain foods, an iodine deficiency is unlikely. With their garden and the location of their home close to the ocean, the garden soil should also be a contributor of this nutrient. Did you get it right? Let's do another. Which of the following is most at risk of developing cellulitis? A. Patient with a BMI of 39 in a vegetative state. B. Type 2 diabetic patient with high blood sugar levels in the middle of the day. C. Breast cancer survivor post 10 years. D. Women taking antibiotics for an upper respiratory infection. The correct answer is A. Patient with a BMI of 39 in a vegetative state. Cellulitis is a bacterial infection that develops in the deep layers of the skin. The skin will appear swollen and red and is typically painful and warm to the touch. Cellulitis may occur anywhere on the body, but typically affects the skin on the lower legs. When a crack or break in the skin is present, bacteria such as Staphylococcus or Streptococcus may enter through the cracks, leading to an infection. Cellulitis is treated with antibiotics, but if left untreated, the infection can spread to the lymph nodes and bloodstream, rapidly becoming a life-threatening issue. Anyone can develop cellulitis, but there are some populations where the risk is increased, such as those with weakened or compromised immune systems, such as those with HIV or AIDS, cancer, leukemia, or those taking certain medications which suppress the immune system. Persons with diabetes due to diabetic neuropathy, which is nerve damage commonly seen in diabetic patients where they may lose sensation in the extremities, particularly in the feet, and may not be aware of a foot injury. Diabetics with poor blood sugar control are also at risk as high blood sugar levels may negatively affect the immune system. Obese or overweight patients and patients with pre-existing skin conditions such as athlete's foot, eczema, or shingles. People with chronic swelling due to lymphedema. The lymphatic fluids that pools in the lower extremities is a fertile ground for bacteria to thrive when they enter the skin and soft tissue. Patients with wounds, injuries, or cuts, since there may already be an opening for bacteria to enter through the skin. Each of the individuals in the answer choices have varying degrees of risk of developing cellulitis. However, the obese patient in a vegetative state would be the most at risk amongst the choices. Why? According to the BMI, the patient is obese. He is bedbound and in a vegetative state, so he is unable to reposition himself and would need to rely on others for repositioning. Because of the possible reduced repositioning fact and the fact of the heavier weight of his limbs, he is more at risk of developing a pressure injury, which is an open wound susceptible for bacterial infection of cellulitis. With the factor of obesity and the lack of movement, he is also at risk of lymphedema. Did you get it right? Let's do another. What is the cutoff age for a household to receive SNAP benefits? A. 5 years. B. 4 years. C. There is no cutoff age for SNAP. D. 8 years. The correct answer is C. There is no cutoff age for SNAP. WIC has a cutoff age of 5 years for a child. The Supplemental Nutrition Assistance Program, or SNAP, has no age restriction for the household. Households of elderly individuals or disabled individuals are also eligible to receive SNAP benefits. Anyone who lives together and prepares meals together is grouped together as one SNAP household. SNAP defines a person to be elderly who is 60 years or older. A disabled individual is a person who meets any of the following criteria: receive federal disability or blindness payments under the Social Security Act, receives state disability or blindness payments based on supplemental security income rules, receives a disability retirement benefit from a government agency because of permanent disability, receives an annuity under the Railroad Retirement Act and are eligible for Medicare or are considered disabled, is a veteran who is totally disabled, permanently homebound, or in need of regular aid and assistance. If a person is 60 years of age or older and unable to purchase and prepare meals separately because of permanent disability, the person and those living within the household are all eligible, granted all individuals living in the household are below 165% of the poverty level. Did you get it right? Let's do another. In a hospital with 300 patients, it takes 10 minutes to prepare one meal. How many FTEs are needed for the week? A. 26.25, B. 19.5, C. 28.9, D. 32. The correct answer is A. 26.25. First, find out how many total meals are needed for the week. 300 patients times 3 meals a day equals 900 meals per day. 900 meals per day times 7 days a week equals 6,300 meals served per week. Then take into account the time per meal. 6,300 meals per week times 10 minutes to produce a meal gives us 63,000 total labor minutes. Double check that your time is in the right form. 63,000 total labor minutes divided by 60 minutes per hour gives us 1,050 total labor hours. Then find the FTEs. 1,050 total labor hours divided by 40 hours per week gives us 26.25 FTEs needed for the week. Did you get it right? Let's do another. Which growth chart is utilized for a 1-year-old infant when measuring length? A. Stature for age 1 to 4 years. B. Age for length, birth to 24 months. C. Height for age, birth to 24 months. D. Length for age, birth to 36 months. The correct answer is D. Length for age, birth to 36 months. To evaluate growth patterns in infants and children, anthropometric data can be plotted on various growth charts. The most commonly used growth charts compare height or length to age, weight to age, head circumference to age, weight to length, BMI to age. Although individual growth patterns vary from one child to the next, the child's growth will generally stay the same percentile throughout childhood. A child who exhibits a sudden drop in a previously steady growth pattern suggests malnutrition. Growth patterns below the 5th percentile may also be a cause for concern. However, the child's genetics must be considered when interpreting low values. In overweight children, the goal is for the weight to remain stable as height increases until the point when weight becomes appropriate for height. Growth charts are based on age and gender. Because of the differences in growth between the sexes, charts are available for boys and for girls. When measuring length, use the growth chart for birth to 36 months. When measuring height, use a growth chart for 2 to 20 years. Height, stature for age is used for boys and girls from 2 to 20 years. Length for age is used for infants from birth to 36 months. While there is an overlap of the 2nd and 3rd years of life, clinical judgment should be used, specifically if the child is able to stand on their own. In which case, a 2-year-old child able to stand would be assessed on the stature for age chart, and conversely, a 2-year-old child who is unable to stand would be measured with the length for age chart. Did you get it right? Let's do another. Which of the following is not a good source of vitamin B12? A. Fish. B. Soybeans. C. Skim milk. D. Eggs. The correct answer is B. Soybeans. Foods derived from animals such as meats, fish, poultry, shellfish, milk, cheese, and eggs provide adequate amounts of vitamin B12. Vegetarians, particularly vegans, are at risk of a vitamin B12 deficiency because they do not consume animal foods and need to supplement their diet with vitamin B12 fortified soy milk, meat replacements, and B12 supplementation. Soy products and plant foods are not good sources of vitamin B12. Did you get it right? Let's do another. What do you suggest for an elderly couple who are able to drive and need assistance? A. FAL-CPA. B. Meals on Wheels. C. Assisted living. D. Food pantry. The correct answer is D. Food pantry. Because this couple can drive and leave the house, they are not eligible for Meals on Wheels. The food pantry offers assistance to those in need and have a means of arriving at the setting. SNAP, or the Supplemental Food Assistance Program, might also be a suggestion for this couple if they meet the income eligibility. Did you get it right? Thank you so much for watching, and please consider liking this video and subscribing to the channel. Bye!